Hello, this is Smita Kumar and you're watching Medicircle. So today we have got a very young entrepreneur on our healthcare startup series, and that's Ajmal Saleem, a doctor to be, because Ajmal is studying his medicals. He's the co-founder and CEO of Treat at Home. Now the startup was featured on Analytics Insights Top 10 Revolutionary AI Companies for 2021. So first of all, let's find out from Ajmal what his startup is all about, and most importantly, when kids at his, people at his age are still trying to find out good career options. Somebody has started with their own startup, and definitely the parents and the community is also supporting it. That's really great to know. So hi Ajmal, welcome to Medicircle.
Hi, Smita. Thank you for inviting me. I'm very glad to participate in this.
I think I'm very glad to host you because when I saw you first time, I thought, oh, am I going to interview you? So seeing your age, I thought that your dad or someone, the mom would be joining in sometime. You're just checking the mic, but it's not that. So it's great to see India being self-reliant at this age. So Ajmal, tell us more about Treat at Home and what are its prime offerings.
Okay. So, Smita, Treat at Home, in simple terms, is bringing healthcare to your doorsteps. So we are a digital healthcare platform where patients can book medical services like doctor visit, nurse, caretaker, and much more. So, to better emphasize and to give a very clear idea, let's take an example, Smita. We'll have this, someone, we'll have this guy named Mr. Chandra, who's a young professional, probably IT guy who works from say 9 a.m. to 6 p.m. His mother needs to be taken to a hospital for a checkup. Our traditional approach, what we have is first he needs to take leave from his office and reach his home. Next is the transportation. He has to bring his mother down, get a cab maybe, and travel to the hospital. Third is the queue. The average waiting time is I'm from a hospital background. My parents run a hospital, so I know it very well. The average waiting time is anywhere between 30 minutes and 1 hour, and the whole process takes minimum half a day. So with this, with the going through the doctor consultation, getting the medication, as well as other things like traveling back, he has to travel back, so it takes minimum half a day. So with Treat at Home, he can stay at his office, open our app, and schedule a home visit. The doctor reaches his home, checks his mother, and lets him know if she really needs to be taken to a hospital. This is because in most cases, more than 60%, what happens is the condition for which the patients are visiting hospital is elective. So, most of the cases, they need simple management like medication, keeping the levels under control, probably the diabetes levels, the blood pressure levels under control, other management which the doctor gives them, and etc. So if the doctor really wants to, go with the lab investigation or like the prescription, Mr. Chandra can book these stuff and get them delivered with the app. So, he can stay at his office, and at the same time, his mother would also be happy because he doesn't have to travel all the way, and she's very comfortable where she is. I think I've given a broad idea of what we do with the Treat at Home.
Bringing doctors to the doorstep is like offered by many other elderly care service startups. Like we have Seno Care, we have Care24. So, what are the prime value propositions of Treat at Home? Ajmal.
Sure, Smita. Sure. So when we had this part for Treat at Home in 2018, we were discussing on why there wasn't any revolution happening in healthcare delivery. We have a lot of other sectors, we have a lot of unicorns in other sectors. But with healthcare, the only disruption was teleconsultation, since it was highly scalable. But teleconsultation, it fits very well with the second opinion, and it also has no physical touch. The doctor cannot meet the patient in person because we need a lot of physical findings to get to know what the disease or condition actually is. Home healthcare was, it had a lot of demand from the beginning, but it was not scaling up. After brainstorming and we did a bit of research, we understood that the scaling up, this lack of scaling up from healthcare startup was basically, particularly in home healthcare, it was due to the employment model of startups. So what we did is, Smita, we started with three unique advantages. First is our aggregator model. We don't employ the doctors, the nurses, caretakers, anyone other than our backend team. What we do is we create a network of existing healthcare professionals and connect them with patients in that region. So that is the first thing. Second is live tracking. Patients can, this is implemented in every sector we can imagine: logistics, food delivery, anything we can, any other sectors. So with Treat at Home, patients can get live location updates and know exactly when the provider will arrive at the place. Third is the option to choose. So patients can view all doctors in their region, go through the details like experience, qualification, and also see the distance from where the doctor is, so that they can choose their closest available doctor. And one more important thing is, we have, after the pandemic, we have a lot of home healthcare startups, home healthcare companies, small-time entrepreneurs coming up everywhere. But we saw that the reliability
accelerated their thing. But as you being a pre-COVID startup, you might have also faced, spur in the volume of especially elderly patients during COVID also and post-COVID also.
Yeah, we did, Smita, because after what we felt is after COVID, patients really understood because we cannot go to a hospital. That is one part. The second thing is what would have taken around 5 to 10 years for the patients to. This has happened with multiple sectors. Patients are now happy that they can get home healthcare professionals like doctors, nurses, everyone at home. So yeah, with that thing, we have this reliability factor. All our providers are verified. So, for example, if there is a doctor, we verify the doctor with their medical registration certificate. And also, we have a competitive pricing strategy and other advantages.
So that's one very important aspect of, having healthcare delivered to your doorstep. So, but there is a question of quality also sometimes arise, that whether you'll be able to access the quality meds. I mean, those who are very much qualified with very much experience, they won't be giving you services on your doorstep. So this is a challenge. So you might have faced this. So what were the cost solutions you offered?
Sure. So yeah, what we did is with first off, we as I said, the 60% of the elective cases, we are targeting that. What we do is we get two patients home with the doctors. The home doctors, as you mentioned, most of them we target on MBBS doctors, people who are writing their PG examinations. They just want some kind of work to go through. They won't be able to work at a full-time shift in a hospital. So these doctors visit patients at home. They just check the patient, check the condition. If the condition is serious, they immediately refer them to hospital. We are building our partner hospitals in every region. In Tamil Nadu, we have done it. With other states, we are trying to build it. So another important thing would be our integrated teleconsultation. What we do is, as you mentioned, we have a specialist. These specialists will be talking to the doctors, physically present in the patient's home. With other teleconsultations, it would generally be the patient telling the whole condition to the doctor themselves, but they won't be able to figure out what the thing actually is. They won't have the medical terms, everything, findings. So we try to overcome with this our integrated teleconsultation. So the MBBS doctor talks to a specialist and gets with a better diagnosis.
So how many patients you have touched so far, and you have made their lives easier by providing them healthcare as a consumer product, right? Access through their mobile apps, the way we used to order food or order a ticket, book a ticket.
Sure, Smita. So we started in 2018, did our beta till early 2020. At that time, we completed around 1,000 bookings. We had a completely freemium model, so we facilitated around 1,000 bookings. During the pandemic, we saw huge demand for the product and started monetizing from May 2020. At that time, till now, we have completed around 2,000 healthcare services. particularly what it means is that we have given medical care for nearly 1,500 patients, and at the same time, we have given job opportunity for nearly 500 healthcare professionals.
Yes, that's
So
it.
that is one part. Yeah. Right now, we have around 1,000 healthcare providers registered in our platform, and our app has nearly 80,000 downloads.
That's great to know. So your company, I mean, your startup is still bootstrapped, or you have raised funding?
Sure, Smita. We are completely bootstrapped, and we have pumped around $100,000 from our own funds. So that is what we have done. This is because what we realized early on is that we are not an idea startup. We are an execution startup. What it means is that to onboard investors at the right valuation, we need to show that our product is highly scalable, it is sustainable, and also show great traction to justify the valuation. Other than that, we have been incubated by NASSCOM 10,000 startups, and actually yesterday it was very good news to get to know. We got into the Microsoft for Startups program,
Oh, wow.
and also have been and also I've been selected for GSF Academy batch of 2022.
Oh,
I got the two good news yesterday.
so
I think probably
the second good news I couldn't hear clearly.
We have got into the GSF Academy with the GSF Accelerator, right? GSF Academy batch of 2022.
That's great then. Double congratulations to you, Ajmal. So definitely if you
Sure.
get validated by any of these brands, or even you get incubated by established incubation cells, you get this feeling that yes, we are working in the right direction. We are definitely trying to solve a problem which exists, and definitely traction would follow, and then definitely you can approach investors, and you can get some great fundings. So tell us something about your revenues. So what were your revenues in FY 2022, and what you're planning to close at the end of FY 2023?
Sure. Total revenue for FY 2022 was close to rupees 53 lakhs from 1,200 healthcare services. For 2023, we are targeting around 4,000 services and 2 crores in revenue.
And so I didn't found you on Shark Tank. Did you apply for that?
No, Smita, I didn't, because as I'm doing my college, I don't want to go with investors. I don't want to go with Shark Tank, because the first question they would ask is, "Are you a full-time founder?" That is not justifiable from my side. So very soon, in the next 6 months, after I get my degree, I'll straight away go to Shark Tank. Probably participate in the next year.
Good. So, and what are the future goals and expansion plans? Like presently, you are based out of Chennai, I suppose. So, how you want to make it available to other places, other parts of India also?
Sure, Smita. As you rightly said, we are right now operational in Tamil Nadu. We are by end of this quarter, we are planning to launch in Bangalore. We've seen a lot of interest from Bangalore, from the doctors as well as the patient side. With that, other than that, what we have done is following that, we'll be creating a network of expanding the network of providers, and I hope to do it by the end of 2024. We'll be present in all major Tier 1, Tier 2 cities of India. We are looking forward to it.
Great. And so, as you yourself are a very young entrepreneur, let me know how challenging was this, and what would you like to share, especially to the young people, young Indians who are watching this video today at Medicircle, to chase their dreams at a very young age, and if they get good support from their communities, parents, families, definitely they can do great. So do let me know your thoughts on the same.
Sure, Smita. I'm young, very young myself. I'm 24, turning 24 this year. So first off, when I started in 2018, as I said, I had these two options, join my college degree or pursue Treat at Home. We read all these, stories of great entrepreneurs. They quit their university and started pursuing their startup idea. But it is not actually, not everyone can do it. So in India, we have our own culture. Our parents, they want us to finish a degree, but it doesn't mean, we have to let go of that spark. So we can keep on reading stuff. We can study the market, try to, if possible, develop a product. We have developed a product, for the 2 years, very slowly, bit by bit, we did it. And we did our beta. fortunately or unfortunately, we had COVID, so we could validate the product in that period. So first is, follow your passion wherever you're at life. Second thing is building the right team. See, as you said, I'm very young, so we need the right team to take our passion and our product to the next level, the greater heights which we aim it to be. Third is we have to keep pivoting. I have learned it myself. What we did is, Smita, as you said, we are trying to get healthcare to doorstep with mobile apps. But when we did our beta, we didn't see scale. That is because people don't have much experience with accessing healthcare through apps. So we pivoted from only app-based model to also call-based. People can now call us and book services. Our working model is different, but we try to keep all the channels open: call, web, app, physical interactions. So we have to keep pivoting. I think that is one part. I read this beautiful quote somewhere, probably from some YC, because I'm very passionate about getting into Y Combinator. So I heard someone saying there. Someone said that the problem you're solving is not very important. Sorry, I'm extremely sorry. Please take this part out. The problem we are trying to solve is the most important and not the solution itself. So we have to be open for change and keep hustling.
Now that's great, because there are so many who actually want to get into this Y Combinators, summer batch, which is going to happen. But yes, definitely you need to dream big. You need to have that zeal and perseverance that definitely you'll achieve to the goals, what you have been taught, what you have been thinking of. And if you get a good team, and if your problem, what you have been trying to solve is genuine, because that's a real problem. I think many startups actually fail there. I mean, they don't scale up just because the problem might what they think it's not good. It's not exactly a problem what they're trying to solve. But as Ajmal is there are so many other young entrepreneurs. We have Ritesh Agrawal, Tilak Mehta, who's just started at the age of 16. Then we have Sri Lakshmi, Trishni, and Akhil Sahu, and Divya. So Ranveer Alabadia is there. So there are so many young entrepreneurs in India, and I'm so glad to host you, Ajmal, today. That yes, that's the changing face of India. What we are welcoming here. Some people may quit universities, quit jobs, and start their passion. That's one thing. But again, even if you're then studying and doing and want to pursue this later, that's also a very good thing. And that way you are trying to solve something which is really we have so many home healthcare so many startups doing a very good thing, performing in the home healthcare sector. But as you started pre-COVID and the COVID wave actually accelerated this, definitely it is going to change the market. There would be many things which would be added, and there is one thing as I would like to share, like how the India is placed if we talk about elderly population. Like it is the second highest elderly population. It hosts the second highest elderly population. Definitely, there is a very good market here, and with over 138 million elderly people in India in 2021. So it is very important that we pay attention to this growing subset of the population. And there are like 67 elderly men and 71 elderly women in India at the time. That means the percentage, which is estimated that the number has risen by 32.7% between the years of 2011 to 2021. While at the same time, the general population has risen over by 12.4%. So we see a huge gap there. So the elder care market in India is definitely today stands at an enormous $1.5 billion, catering to anything from adult diapers to diagnostics to medical services, then to providing their post-op care, from senior citizens residential complexes to security devices given to them for other hospital care and healthcare providers. So the Indian home healthcare market, if we see, it is like valued at 5.2 USD billion dollars, and in 2019 it was projected to expand at a CAGR of 19.2%. That is from 2022 to 2027. Now, according to WHO, like this chronic and lifestyle diseases are also expected to increase, and that is actually going to increase the healthcare expenditure in India over the next 25 years. So definitely, this sector is completely promising. And startups like Treat are at home. That is one very good initiative by Ajmal Saleem, and it was really great, Ajmal, to host you here at the Healthcare Startup Series at Medicircle. Wish you all the best, and so that you get next year into Shark Tanks as you are, expecting
Sure,
or
sure.
Y Combinator. All the best from Team Medicircle, and thank you once again for joining us.
Sure, Smita. Thank you so much. One more thing to add is you guys are doing an awesome job at Medicircle, because probably 5 years before we didn't have someone who's dedicated towards healthcare. We startups, we need a lot of exposure. You guys are doing an awesome job, because I've watched most of your interviews with entrepreneurs, because I was going through how was the model working on, what is the method of going through, because most interviews are not focused on just on the problem and just on the solution. They just have a very it is a very broad interview, but you cannot gather more insights. But your interviews have been very focused, and thank you. It was a wonderful opportunity for me to talk with you, Smita.
Thank you so much for appreciating Medicircle. This has been a core objective why we started, because definitely if there are healthcare entrepreneurs, if we want India to be self-reliant, definitely our people must be starting and solving their problems own. We should not depend on countries outside India to help us or to support us. So definitely we should be talking more about startups, how they are doing. Yes, there would be some failures, but that does not matter, that they're not going to be
Definitely,
successful sometimes. So yes, failures, and these are the
definitely,
part and parcel of the journey. We should be going ahead and believing in our dreams. Definitely, the questions are curated in such a way that in very small span of time, we are able to know more about the startup. Because see,
yeah,
one startup, they need to reach the audience, the niche audience, and
hmm,
we have got a niche
definitely,
healthcare consumer base. And that is why we interview startups, just because that voice should be heard. They should be knowing more about that. Yes, if we want to connect with an elder care provider, if we want to connect with someone who can provide us with some assured good quality healthcare provider services right at the doorsteps, what is their number,
definitely,
what is the how they are doing, what are the reviews. And that is one thing which we are trying to solve, which we are like the problem of awareness, because there are so many startups doing really great, but there are very few media brands who is promoting that. And I think we are trying to
definitely.
solve that problem. So thank you, Ajmal. It
Yes,
was really
Smita. Yeah,
great talking to you, and all the best for your future endeavors.
same here. Thank you, Smita. Take care.